Good afternoon, everyone. Thank you so much to Dr. Omar Latif and to the entire Rush Medical community for hosting us today. Thank you. We are now on day 2 of the mask requirement being lifted across the state of Illinois. And it comes as we mark a significant milestone in our journey with this virus. More than 8 million people in Illinois are fully vaccinated. Each day we average another 16,000 more COVID-19 vaccinations, including about 4,600 people who are getting vaccinated for the first time each day. Throughout this pandemic, we've taken action to save lives while keeping our economy open. And I'm proud that Illinoisans have done the hard work that has made our state a leader here in the Midwest. Today, our hospitals are returning to more normal patient admissions and are better able to attend to their patients, including those with COVID-19, but also those who have suffered heart attacks, are recovering from car accidents, undergoing cancer treatment, or welcoming a new baby into the world. With the removal of mask requirements in most settings, some Illinoisans may choose to continue wearing masks out and about, even when it's not required. Others won't. And this is a moment when I want to ask everyone to treat each other with kindness and with compassion. What's right for someone else may not be what you would choose, but remember that we should all default to what will keep each other safe and healthy. Someone in your presence may be more vulnerable than you are to the worst effects of COVID. Each of our actions in the presence of a deadly disease can affect the next person. COVID has not been eradicated. Today especially, I find myself reflecting on the journey of the last 2 years. 2 years ago this week, 2 more Illinoisans had tested positive for COVID-19, for a grand total of 4 known cases at that point in the pandemic. 4. At that time, Illinois was the first state that could run our own tests for the virus. In a matter of days, given the speed the virus was making people ill, we would issue a disaster proclamation to activate an all-hands-on-deck approach to this virus. Shortly after, Illinois would become the second state in the nation to issue a stay-at-home order, an unprecedented action to address an unprecedented unknown. Remembering those early days of trepidation, foreboding, and countless unknowns, there is not one of us who could have predicted the full extent of what was to come. A global movement of solidarity and compassion, the sounds of pots and pans clanging the world over, incomparable loss, trauma, frustration, from jobs to dreams to moments, of course, of many thousands of people being affected. Even, unfortunately, a loud minority of voices who have used this emergency to naysay, to bicker, to polarize, and to divide. And through it all, we saw example after example of the unbounded depth of human kindness, from food and gifts for healthcare workers, to hunkering down for our seniors, to wearing a mask to protect strangers, to hosting a food drive or a blood drive or a tutoring group. In this most trying moment of our era, Illinois reminds me every single day of her kindness and her hope. I don't know what's next for us in this pandemic. We have all seen indicators of positive progress, but there is no metric that can predict the future. If there's going to be another concerning variant, or if we convince more of our neighbors to get vaccinated, those are things that are under our control. As for when the pandemic becomes endemic, there's no on-off switch, and such a declaration is not mine to make. I've always promised to listen to the experts, and I'm not going to stop doing that right now. Here's what I do know. Illinoisans are equipped. We live in a moment that has demanded more sacrifice than has been fair. but I have never doubted the ability of the people of this state to see it through. I know that today, with 80% of our seniors and more than half of our eligible residents boosted, and with Illinois leading the Midwest in vaccination rates for young and old alike, it is so good to see so many smiling faces again. The majority of the people of this state did not hesitate to do the right thing for their family, for their friends, for their community, and today we reap the benefits now of that commitment. I know that no matter what comes next, Illinoisans are fundamentally all about looking out for one another. Nowhere is that spirit more evident than in the Illinois medical community. In addition to Dr. Lateef, I am joined today by Julie Pride, the administrator of the Champaign Public Health Department, A.J. Wilhelmi, the president and CEO of the Illinois Health and Hospital Association, and of course our own Illinois Department of Public Health Director, Dr. Ngozi Ezike. From the halls of our hospitals to health clinics to local health departments, these individuals have had no respite from the unrelenting agony of the most brutal parts of this global pandemic. For 2 years, they have battled an invisible enemy with the weight of the world on their shoulders, followed by the burden of saving people who don't believe sometimes that they need to be saved. These people are warriors. There is no other word for it. They give and they give and they give when so many have needed them. Many have done so while missing family birthdays, holidays, and milestones. They have stretched themselves into superhumans, and in doing so, offer the greatest recent examples of humanity and caring. I am deeply, deeply grateful. I always will be. And so are the people of this state. And on that note, I have an announcement and a particularly special thank you to make today. For over 3 years, Dr. Ngozi Ezike has served as head of the Illinois Department of Public Health. With all her being, she has dedicated each day, and I mean every day, to the agency's mission to protect the health and wellness of the people of Illinois. For much of the last 2 years, she's dedicated every night too. Even with this unprecedented internal workload, Dr. Ezike prioritized joining me at more than 160 COVID press conferences, make that 161, providing not only the latest expertise and data, but also her empathy and her compassion, becoming a beacon of stability for millions during a time of tremendous uncertainty. And she's been doing so both in English and in Spanish. She has an unshakable faith in God, and she has leaned on her faith to give her the strength to care for the world. I have watched Dr. Ezike mourn the loss of every one of the more than 32,000 Illinoisans who have died from COVID-19. This pandemic is a collective trauma that has, for many, numbed their ability to comprehend death on a massive scale. Not Dr. Ezike. No number of sleepless nights and endless days could wear her down her commitment to think first and foremost of Illinois' most vulnerable. I ran for office. She did not. But throughout the crisis, she has stood beside me every step of the way. I am not putting it lightly when I say that she has had one of the hardest jobs in the world. There is something particularly heroic about the service of an extraordinary individual who did not seek greatness, but found it anyway. Dr. Ezike's last day leading our Department of Public Health will be March 14th. It is a change that I'm loath to accept. But perhaps she can finally get a good night's sleep and precious time with her husband and her 4 kids, and boy, it is well deserved. I have utmost faith that Dr. Ezike's next journey will also bring more good to the world. as has been the hallmark of every step of her career. She will go down in the Illinois history books as a woman who changed our state for the better. She saved lives, many, many thousands of lives. And on that note, I have issued a proclamation declaring today, Tuesday, March 1st, to be Dr. Ngozi Ezike Day in the state of Illinois. I ask all of our residents to take a moment today or any day in the future to thank her for her unprecedented public service in the face of a global COVID-19 pandemic. Dr. Ezike has big shoes to fill. She leaves behind these big shoes, and I'm pleased to announce that one of her top deputies, Amal Tokars, who has joined us at COVID-19 updates in the past, will be leading IDPH in the interim as we look for a permanent successor. Amal Tokars has been an instrumental senior member of Dr. Ezike's leadership team, and the people of Illinois will be lucky to have her watching out for them. And with that, I'd like to turn it over to a few medical professionals who wanted to take a moment to thank Dr. Ezike themselves. And we'll start with A.J. Wilhelmi, the president and CEO of the Illinois Health and Hospital Association. A.J.?
Thank you, Governor, and good afternoon, everyone. I also want to thank Dr. Omar Lateef for his hosting us today and also for his tremendous leadership throughout this pandemic. And if I could just say a few words before I recognize Dr. Ezike, Governor, I do want to let you know that we greatly appreciate your leadership. And I want to echo your remarks and offer a heartfelt thank you to the hospital workers and hospital leaders who have been at the epicenter of this pandemic. Through 5 surges of the virus under the most extreme circumstances, healthcare workers provided compassionate, quality care, saving literally thousands of lives in the process. And despite the many challenges, the hospital community has managed through the pandemic with hospital leaders relying on their communal knowledge and experience to avoid a breakdown in the state's healthcare system. Good leaders set the tone and allow experts to utilize their expertise and do their jobs in times of crisis. And Governor Pritzker did that throughout this pandemic. So, Governor, I want to personally thank you, and on behalf of the entire Illinois hospital community, I want to thank Dr. Ezike, I want to thank Deputy Governor Sol Flores and your entire team, all of whom were instrumental in allowing hospitals to provide their very best care to patients across the state of Illinois. And Governor, you and your team gave hospitals the flexibility to effectively adapt and respond to the public health emergency. You helped hospitals secure the scarce resources they required. It has truly been a strong and effective partnership. And now, even with this critical support and collaboration, the pandemic has taken a toll on all of us, including our healthcare facilities. Hospitals are one of the few entities in a community that are always open. Every hour of the day, every day of the year, when you need care, you go to your local hospital. And while we're all relieved to see COVID-19 hospitalization decline, as you said, Governor, we know hospitals will continue to be active as patients who deferred care during the pandemic return to the hospital to catch up on needed medical appointments and surgeries, and patients are certainly encouraged to do just that. So after 2 years of confronting challenge after challenge and enduring organizational stress and fatigue, hospitals are financially strained. But just as concerning, they're now dealing with workforce shortages that threaten their mission to provide accessible quality care to all Illinois residents. And IHA again wants to applaud Governor Pritzker for including a healthcare workforce initiative in his budget to help hospitals address staffing issues and provide relief to healthcare workers. Building on the cooperation demonstrated over the past 2 years, we look forward to continued collaboration in the coming weeks with the governor and his team and the legislature to begin to relieve the pressure the last 2 years have placed on the hospital community and those within that community who have given their all during this pandemic. Our continued partnership will be critical as we work together to recover from the stresses of the pandemic and to further strengthen our healthcare system as we look ahead to the endemic phase of COVID-19. And if you just give me one more minute, I do want to, at this time, recognize a colleague in Dr. Ngozi Ezike, someone who has shown tirelessly her passion and commitment to keeping Illinoisans safe. I personally witnessed Dr. Ezike's deep commitment to protecting the residents of Illinois from this deadly virus, and I know she put everything she had into her role. So Dr. Ezike, on behalf of the entire Illinois hospital community, thank you for your outstanding leadership under the most challenging circumstances, for your support of hospitals and healthcare workers across the state of Illinois, and for our strong partnership throughout this pandemic. On a personal note, it has been a real pleasure to get to know you and to have the opportunity to work closely with you for the past 2 years, and I wish you all the best going forward. And now it is my pleasure to introduce Julie Pride.
Hi, good afternoon. I want to first thank Governor Pritzker for the opportunity to be here today and for this welcome announcement on our path to safely restore Illinois and for always leading with science and sound public health. We all know that that has not been the case in other parts of this country. Of course, I want to thank Dr. Ezike for her amazing, consistent, steadfast leadership, innovative ideas, and her commitment to working closely with local health departments through this incredibly difficult time. Her leadership has been inspiring and so appreciated. In Champaign County, as all over Illinois, we are eager to see this pandemic in a rearview mirror. While we're not there yet, we are in a very hopeful place. We now have enough community immunity that along with the vaccines and treatments, we can transition to the endemic phase by focusing on preventing medically significant illness and healthcare system strain. In Champaign County, we have lost 290 of our residents, and while that number is devastating, and I've certainly felt every one of them, I can't imagine what Dr. Ezike has gone through, because you do feel it. They're more than numbers. It could have been far worse, excuse me. As we move into the next phase of COVID, this is not good. I'm sorry. As we move into this, see there, that's so typical. I'm struggling. I'm on the verge of tears in front of everyone. And who comes to the rescue? Dr. Ezike. As we move into the next phase of COVID, we will continue to encourage vaccination as the single best practice to protect our healthcare system and to further prevent needless deaths. We will continue to build our public health capacity and infrastructure, including use of data-driven technology, and we will continue to dispel myths and rumors that have been the cause of so many unnecessary hospitalizations and deaths. And most importantly, we will continue the partnerships forged during this pandemic and will work to make the public health system even stronger and more resilient. And now I'll just rub my nose in front of all these cameras. I am honored that I am the one who gets to introduce Dr. Ezike on behalf of my staff of 200, my community, who have been amazing partners through this, and the other health department administrators in the state of Illinois. I can say this is my third pandemic, and I simply cannot wrap my head around doing this without you and Governor Pritzker in the leadership roles. So it is my great honor and my heartfelt appreciation and pain because she's leaving, but that I welcome Dr. Ezike and thank her so much for her service. Thank you.
So again, as all of the speakers have mentioned, we have embarked on a new chapter in our COVID journey, and I just want to highlight that as the mask requirement has been lifted, it does not mean that it's not recommended. And as we think about our individual situations and who we may be coming around with, who we are living with, it may absolutely be the case that you are an individual either because of your own self-assessment, risk assessment, or because of those that you live with, that you will continue to wear a mask. And so I echo the pleas from Governor Pritzker, honorary MD, that we just be respectful of each other's choices. No one knows. You could be working side by side with someone who is undergoing chemotherapy unbeknownst to you. You could be working right by someone who goes home and takes care of a severely immunocompromised child or parent. We don't know what people are dealing with, and so let's respect each other's choices and equally respect those who have chosen not to wear a mask for whatever their situation is as well. It has been just an honor to be able to share these updates, share information, help create policy. Thinking back, January 2019, I got a call from a blocked number that I answered, and it was at that time that Governor Pritzker offered, and I accepted the offer to serve as the director of the Illinois Department of Public Health. Looking back at notes and journal entries that I had created at that time, I have several quotes that I just jotted down that were from that time. One said, "Wow, a dream is coming true for me even before I ever dreamt the dream, but it's now my reality." Another one said, "I'm so excited to grow and be stretched to new limits." Didn't exactly know the full impact of that. Another said, "I just look forward to doing wonderful things for the residents of Illinois. I'm so ready for this work." Again, this was January 2019. I did not know fully what I was getting into, but I had ideals that I believed in that would be my guiding light, my North Star. One is that believing that everyone deserves the opportunity to achieve their best health. A second is that intentionality is required to address long-forsaken needs of selected populations. That's now referred to succinctly as equity. And third, that to best care for a diverse population like we are so blessed to have in Illinois, you need a team that reflects that diversity to create the most robust and inclusive solutions. I cannot say enough to Governor Pritzker for the honor and the privilege that you afforded me. This incredible opportunity has been the pinnacle of my career thus far. And I can't see my words. Okay. Right back at you. Okay. It has been an incredible opportunity to work with the governor's office team, all the state agencies, including a special shout out to the HHS portfolio led by Deputy Governor Sol Flores and First Assistant Lizzie Whitehorn. It has been the honor of a lifetime to lead #Team IDPH. IDPH consists of a team of unsung heroes that by nature and definition works behind the scenes, who's committed to public health, and that commitment gave me strength every day. Of course, my main battery charger came from my deep-seated faith, and I absolutely received the renewing strength that people all across Illinois sent me through their prayers that also covered me. All of the people and all of their stories I will carry always in my heart. I acknowledge and mourn with the families of all the lives lost, not just to COVID, but to gun violence, to suicide, to drug overdose, to racism, to cancer, and all the other diseases and ills that public health officials and all of our partners work tirelessly to curb. Being a half full kind of gal, I am focusing in on all the positive actions of so many private citizens and all the stakeholders who have helped get us through these tough times. Too many partners for me to name without knowing that I will forget someone critical, but we saw clearly that there is no community without unity. It's right there at the end of the word. For so many of you, you took actions to support others. You wanted to support people that were less fortunate than you. And I salute you for being able to be selfless and to maybe even inconvenience yourself by a little bit to help support the health of others. Your selflessness supports our society. Again, it's just been my tremendous pleasure to serve the people of Illinois. I am so blessed to have been able to bring some measure of comfort to Illinoisans, to quiet some of the chaos and infuse some calm. I'm glad that I served as a role model to young girls, girls of color, little black girls, that they can be leaders in any field. And I'm proud to show our young boys as well, the future men of our society, examples of women in leadership. I'm proud to exemplify that empathy and strength can exist in the same body and in the same breath. Lastly, there is another group, a smaller group of people who also sacrificed a lot in order to allow me to serve Illinois. I'm sorry. Okay. Just a second. Okay. Yeah. Another group sacrificed a lot in order to allow me to serve. And it's time that I try to make amends for their sacrifices. I want to thank my family. I know my husband's here, and my daughter, the first daughter, is here, and my extended family and my mother for tolerating the absences, the last-minute changes in plans, the endless multitasking, and the ever-present cell phones. You have stood by and you have supported me, and you have not complained, and you have made dinners, and you've done all the pickups and the drop-offs. But now it's time for me to make you my priority and give back a portion of the attention and the encouragement and the support that you lavished on me. Thank you for your tolerance and your patience. I love you more than any words could ever express. So after 1,125 days in this incredible role, I think about some of the sentiments that I expressed even before I joined the role, and they still ring true. I still look forward to doing wonderful things for the residents of Illinois. I'm still excited to continue growing and stretching to new limits. And I remain ever so grateful for this incredible opportunity. People of Illinois, rest assured that you will continue to be well served by #TeamIDPH. We will continue to be working and advocating on your behalf. Thank you again, Governor Pritzker. Thank you to all the people of Illinois. And may God bless our great state, our country, and our world with health, with peace, and with love. And I don't think I can leave without summarizing my notes in Spanish, so I'm going to do that. En enero del 2019 recibí una llamada de un número bloqueada que contesté. Fue cuando el gobernador Pritzker me ofreció y acepté la oferta de servir como directora del Departamento de Salud Pública de Illinois. Mirando hacia atrás en notas y entradas de diario, un sueño hecho realidad para mí incluso antes de haber soñado. El sueño es ahora mi realidad. Estoy muy agradecida por esta oportunidad. Estoy emocionada de crecer y llegar a nuevos límites. Espero hacer cosas maravillosas para los residentes de Illinois. Estoy lista para trabajar. No sabía completamente en lo que me estaba metiendo, pero tenía ideales en los que creía que serían muy luz de guía, creyendo que todos merecen la oportunidad de lograr su mejor salud, que la intencionalidad es necesaria para atender las necesidades largamente olvidadas de las poblaciones seleccionadas, ahora referido sucintamente como equidad. Para atender mejor a una población diversa, se necesita un equipo que refleje esa diversidad para crear las soluciones más sólidas e inclusivas. No puede decir lo suficiente, gobernador Pritzker. Me siento muy honrada y privilegiada de que me haya dado esta oportunidad. Ha sido un viaje increíble. Es increíble trabajar con el equipo de la oficina del gobernador, con señora Sol Flores y Lizzie Whitehorn, con todas las agencias estatales. Un saludo especial al colectivo del Departamento de Salud y Servicios Humanos. Ha sido el honor de mi carrera profesional liderar el equipo IDPH. El IDPH está formado por un equipo de héroes anónimos cuyo compromiso con la salud pública me fortaleció todos los días. Por supuesto, mi cargador de batería principal provino de mi fe profunda y recibí absolutamente la fuerza renovadora que la gente de Illinois me envió a través de sus oraciones que también me cubrieron. Las personas y sus historias las llevaré siempre en mi corazón. Reconozco y lamento con sus familias todas las vidas perdidas por la violencia de las armas, el suicidio, las sobredosis de drogas, el racismo, el cáncer y el COVID y todas las demás enfermedades y males que trabajamos incansablemente para frenar. Soy de vaso medio lleno, así que me estoy enfocando en todas las acciones positivas de tantos ciudadanos privados y organizaciones interesadas para ayudar a otros en tiempos difíciles. Hay demasiados socios para nombrar sin olvidar a alguien crítico, pero vimos que no hay comunidad sin unidad. Para tantos de ustedes que tomaron medidas para apoyar a otros en una situación más precaria que la suya, los saludo. Su desinterés apoyo a toda la sociedad. Ha sido un placer servir a la gente de Illinois. Me siento bendecida por haber podido brindar algo de consuelo a los habitantes de Illinois para calmar parte del caos y infundir algo de calma. Me alegro de haber servido de modelo a las jóvenes, incluidas las de color, de que pueden ser líderes en cualquier área. Estoy orgullosa de mostrarles a nuestros jóvenes, a los futuros hombres, otro ejemplo de mujeres en el liderazgo. Estoy orgulloso de ser un ejemplo de empatía y fuerza en el mismo cuerpo y aliento. Por último, hay un grupo pequeño, pero muy importante, de personas que han sacrificado mucho para que yo pudiera servir a Illinois. Y ya es hora de que intente compensar sus sacrificios. Gracias a mi familia, mi esposa es aquí. Y mi madre, mi familia inmediatamente y extendida, por tolerar mis ausencias, los cambios de planes de última hora, las interminables multitareas y los siempre presentes teléfonos móviles. Ustedes se han mantenido al lado, apoyándome y sin quejarse nunca. Pero ahora es el momento de prioridad y les devuelva una parte de la atención, el ánimo y el apoyo que me prodigaron. Gracias por su tolerancia y paciencia. Los amo más de lo que cualquier palabra podría expresar. Así, después de 1125 días, los sentimientos que expresé antes de mi primer día en el Departamento de Salud Pública de Illinois aún son ciertos. Estoy muy agradecida por esta oportunidad. Estoy emocionando de crecer y llegar a nuevos límites. Todavía espero hacer cosas maravillosas para los residentes de Illinois. Gente de Illinois, tengan la seguridad de que seguirán siendo bien atendidos con el equipo de IDPH, trabajando y abogando en su nombre. Gracias, gobernador Pritzker, y a la gente de Illinois. Y que Dios bendiga nuestro gran estado, nuestro país y nuestro mundo con salud, paz y amor. Mucho gusto por su apoyo.
As hard as I think this will be, I'm happy to take any questions from members of the media.
Well, we'd love to ask a couple of questions to Dr. Ezike if you'd let us. Right here
All right, what you got?
I've got one personal question and one in your role as still as IPH director. First of all, congratulations on finally being able to get some sleep and some family time. You've obviously had a lot to deal with in your position over the last couple of years, including, unfortunately, threats and attacks on your person. What made this the right moment to leave, and is there already a next step for you?
Yeah. No, I think there's a lull in COVID cases and hospitalizations. That's a great thing. I'm hoping that with all the vaccinations and the therapeutics that are available, that we will have, a quiet spring. Spring and the summer have typically been stable times. So this is my chance. So we are looking forward to hopefully a lull where we will keep things stable. We don't know what the future holds, but I think if there was going to be a more stable time where we could make this difficult transition, I hope that that's now. I have no announcements at all in terms of what the next steps are. The next steps are to finish out these next couple of weeks and try to effect a seamless transition. to be able to step away from the role, try to reconnect with self and family, and just catch a breather.
And one question just on, obviously, still on COVID, with the changing guidance in terms of drafting mask mandates for early childhood settings. You know, one question that I got from a colleague was, why is it okay for children under 5 to remove their masks if they're not yet eligible to be vaccinated?
Yeah, no, that's a very fair question. I think if we look, and we need to remember this, when we look at who has been hospitalized, let's just take the last 4 weeks. 60% of the people that filled the hospital beds were people 50 and over who were not vaccinated. I mean, the facts are what they are. And if you look at the next group in terms of who also were filling hospitals, they were either people with significant comorbid conditions, immunocompromised, or people who did the right thing, got boosted, been fully vaccinated, boosted, but just by virtue of their age, we know that there's something called immunosenescence, where your immune system is not the same if you're 70 or 80 as it is when you're 20. We know that our younger people have fared well with this disease compared to some other disease. They've done better with this than they have with the flu or RSV. And we know, and there's even a study that just came out by the CDC now looking at how much protection you can give your unvaccinated child just by the people in that household being protected. So when you put all of that together and you recognize where we are in terms of the amount of disease, and it really has come down. Let's remember that the community guidelines, the community level guidelines that are put in place, they're not a forever status. Things could change. So what we're seeing today is how we are recommending actions and people to take certain actions or not. But unfortunately, there have been too many curveballs. We don't know what next week, next month, in the 3 months. And so we can maybe enjoy this period now. Hopefully that is something that will continue, but we will continue to follow any potential surges, through wastewater, through patterns of testing to figure out if there needs to be a change that will be recommended. So again, I'm so grateful to be in a state where people have really tried to follow the data and the science. And so there's not been a departure from that. And we will continue to try to make the best decisions. But remembering that if you do have a child who might be immunocompromised, that's a different situation. And so people need to remember that. I've been using this example. Let me just take the liberty. If you were in a classroom and there was a kid who had a peanut allergy and they could die if they were exposed to peanuts, I think I've seen it happen. I've even seen it happen on the planes where they will tell everybody on the plane or everybody in the classroom, no peanuts in this classroom. And even if, kid over here is like, but my favorite lunchtime sandwich is peanut butter and jelly, we would expect that person to forego their favorite sandwich to protect the life of their classmate. And so we still have to be in that mode where if there's a specific circumstance where you can help a small bit by doing something really, I think, as simple as wearing a mask, and that might help decrease somebody's chance of getting ill, I hope that's something that we can collectively still do for our fellow humans.
Last but not least, speaking of curveballs, what would you want to tell to parents who are now a little bit worried when they hear the news that the vaccine isn't as effective on 5 to 11-year-olds when it comes to preventing Omicron?
Yeah, let's parse this out. So what it said is that it doesn't protect as well against getting infected. And for a lot of people who have been vaccinated and boosted, we know Omicron swept through and still caused infection, but they did not end up in the hospital. So we need to redirect and focus on what it still does, and that was still to minimize hospitalizations. And I think if you're going to choose something that the vaccine will do, you want it to prevent hospitalizations and death, and it still did do that. All right.
You said that when you were accepting this position,
No, I have grown as a leader. I keep telling people, I was just speaking at my local high school at the Model UN conference, and I was talking to about 600 high schoolers on Saturday morning, and I was telling them that leadership is not a destination. It's a continuous journey, and we are all leaders. You might be a leader in the fact that you're the firstborn in the family, and so you have some kind of responsibility over your siblings. You could be a leader in a classroom where you're the one that speaks up if you see that someone is being bullied. I have been able to continue to grow leadership skills in all directions, not perfecting anything yet. I feel like there's still plenty of room to grow. My staff can tell you for that's true. But I think definitely learning the best ways to navigate difficult conversations, understanding how to bring people of different backgrounds with different desires, how to find something that might maybe not satisfy everyone, but at least be clear enough in communication to explain why you landed here and have them at least respect the process of your thinking. Being able to make decisions quickly when they need to be versus gathering everybody together and getting all the troops together to get buy-in from many stakeholders, figuring out when and where you pull which lever. All of those things I am still growing and have been blessed to have the opportunity to really probably grow faster than I would have in another role in another time, but definitely feel that I was called for such a time as this and appreciate all of the growth. Thank you.
All right, thank you, everyone.
Thank
Can I
you.
ask one off-topic question of the governor? Governor, last night you sent letters to the heads of pension systems in the state to ask for the possibility of divesting themselves from any assets that are Russian assets or from Russian-based companies. How realistic, feasible is this? Have you heard back from them yet?
Have not yet heard back from the 5 pension systems, and that's why I asked them, as I did, to look into how they might accomplish that. It's not an easy task, and there are a variety of reasons why it's not an easy task, but it's an important task. And so divesting of Russian assets, Russian investments at this moment when Russia is a terrible aggressor, killing people seemingly endlessly across Ukraine, we need to take action, all of us, in any way that we can, and certainly the state of Illinois. If we have any investments, and I don't know that we do, but if we do, we should take that action. Yep. Thank you very much.